Imagine waking up one day and feeling as if your body's at war with itself. Your heart is racing, your blood pressure is spiking, and you have no idea why. Now imagine collapsing at 30,000 feet in the air, wondering if you'll ever see your family again. That was me. And the villain in my story? A tiny gland, the size of a walnut sitting on top of my kidney, secretly flooding my body with hormones that were slowly destroying me from the inside out. This is the story of how surgeons went inside my body and removed the traitor that nearly cost me everything. Disclaimer: before we begin, please note that this video is for informational and educational purposes only and is not medical advice. If you have any medical concerns or health issues, please consult with a qualified healthcare professional. All information presented here is based on research and real-life experiences. My story: I'm Joe, 40 years old. For years, dangerous blood pressure levels stumped my doctors. Different medications, lifestyle changes, stress management. Nothing worked. Then, on a flight from Rome to London, everything changed. The cabin spun. My vision tunneled. I collapsed in the aisle, surrounded by panicked passengers. One thought consumed me. I'm having a stroke and I might not survive. The investigations were exhausting. Blood tests, scans, more scans. Then Professor Hills found it. My adrenal gland was producing excessive hormones, poisoning my cardiovascular system daily. The solution? Surgical removal. It terrified me, but staying that way was a death sentence. Since surgery, my life transformed. Blood pressure normalized. Constant anxiety vanished. I got my body back. If you have unexplained high blood pressure or mysterious symptoms, ask about your adrenal glands. It could save your life. The procedure. Pre-surgery preparation is crucial. Medications stabilize your hormones and blood pressure to prevent a hypertensive crisis during surgery. Surgery day arrives. Under general anesthesia in the operating room, the work begins. Most adrenalectomies are laparoscopic, 3 or 4 tiny cuts across your abdomen. Surgeons insert specialized instruments and a high-definition camera. Carbon dioxide inflates your abdomen, creating space for work. Minimally invasive means less pain, less scarring, and a faster recovery, but it demands incredible skill. Your adrenal glands sit in crowded territory. The right hides behind your liver near the inferior vena cava. Mine was on the left, hiding behind your spleen and pancreas. Above my kidney, surgeons gently move organs aside with retractors, like retrieving something from a packed closet without disturbing anything else. Once visible, precision becomes everything. Surgeons carefully dissect through the surrounding fatty tissue and blood vessels, exposing the gland bit by bit. The most dangerous moment? Controlling the adrenal vein drains into major blood vessels. They identify, isolate, and seal it with clips or cauterization. One rupture creates an emergency. With the blood supply secured, they free the gland from the kidney beneath, methodically separating the thin connective tissue layer. Finally, the gland is removed and placed into a specimen bag inside your abdomen, then extracted through a port, preventing tumor cells from spilling. Surgeons survey for bleeding, irrigate with saline, and double-check every clip. Instruments removed, carbon dioxide released, abdomen deflates, tiny incisions closed. Complete. Years of development, months of diagnosis, corrected in hours. Sometimes tumors are too large or complicated, requiring open adrenalectomy, larger incisions through the abdomen or back. Longer recovery, but sometimes safest. After surgery, you wake up in recovery, groggy and sore but alive. For me, that first moment of consciousness was overwhelming. It was done. The thing that had been terrorizing my body was gone. The hospital stay is typically 1 to 3 days if you had laparoscopic surgery, maybe longer if it was open. The pain is manageable with medication, and you were encouraged to get up and walk as soon as possible to prevent blood clots and speed healing. But here's something critical. If both adrenal glands are removed, or if your remaining gland isn't functioning properly, you'll need hormone replacement therapy for life. These glands produce cortisol, aldosterone, and adrenaline, hormones your body absolutely needs to survive. Without them, you'd go into adrenal crisis, a life-threatening condition. For me, with one gland still intact, my body adjusted, and I didn't need replacement therapy. But everyone's situation is different, and endocrinologists monitor you closely. The recovery at home is gradual. You're tired, your abdomen is sore, and you can't lift anything heavy for weeks. But day by day, you feel yourself returning. The fatigue lifts, the incisions heal, and then you start noticing the bigger changes. For me, it was the blood pressure. Watching those numbers drop to normal and stay there felt like a miracle. No more pounding headaches. No more feeling like my heart was going to explode out of my chest. I was getting my life back, piece by piece. But emotional recovery is just as important as physical recovery. You've been through trauma, even if it's medically necessary trauma. Give yourself grace. Talk to people. Process it. Here's what I want you to understand. Adrenal gland disorders are often misdiagnosed or missed entirely. Symptoms like high blood pressure, unexplained weight changes, fatigue, and anxiety can be blamed on stress or lifestyle when the real culprit is hormonal. If you're struggling with these issues and traditional treatments aren't working, advocate for yourself. Ask about your adrenal glands. Request the specific tests, 24-hour urine collection, blood aldosterone and renin levels, and imaging scans. Don't let doctors dismiss you. I almost died because we didn't catch it sooner. You deserve answers, and you deserve to feel well. Your body is telling you something. Listen to it. The surgery that saved my life isn't just a medical procedure. It's a second chance. Every day since, I wake up grateful. Grateful for Professor Hills and his team. Grateful for medical technology that allows surgeons to perform miracles through tiny incisions. Grateful that I survived that flight, that I got answers, that I'm here to share this story with you. If even one person watching this gets checked, gets diagnosed, gets treated, then telling my story was worth it. Your health is everything. Don't wait for a crisis. Don't ignore the warning signs. And remember, inside your body right now, every organ has a job. And when one goes rogue, modern medicine can step in and set things right. Stay curious, stay informed, and take care of yourself. I'll see you in the next one.